What's up, Jackson ED team? Kind of got a important update coming right ahead to you. I know we talked about the clinical decision unit opening sometime in September, but the ED management team has met with the hospital administration, and looks like we're shooting for Monday. So going to get after it. I figured this is probably the quickest way to kind of get all the communication across the board. So the clinical decision unit is the old 2 East. We'll be using it for observation patients. Our goal is to keep them there, no more than 24 hours. They'll be admitted up there. We'll document on them. The documentation will be somewhat different, which I'll also come out with another video that'll be explaining step-by-step process on what needs to be documented. The hospitalists will be seeing the patients initially once they get to the floor. We've met with them already. Once the orders are written and all that, everything is carried out. Where they also want to be contacted, let know everything's back, so we kind of help with throughput and getting patients in and out up there. Just in case there's a low census of observation patients, we will be putting some remote teleholds up there, and then Bed Control will be assigning them rooms from there to kind of help with facilitating people throughout the department and the hospital. Other than that, as far as processes, labs, there will be a phlebotomist that will come draw your labs. There will not be a label printer. It will show up on their handheld. As far as pharmacy, if you need a particular med, we will need to fax it to pharmacy what med we need, but there will be bins in the supply room that the pharmacy tech will drop off the medications that you will need if they're not stocked in the Omnicell. From a documentation standpoint, there will be admission assessment that needs to be done, 2 care plans, and discharge instructions and assessment. But like I said, once again, we'll be bringing that to you here before long also, and educating you on what needs to be documented and what's required. Who will be assigning the patients to go up there will be the ED charge nurse. They'll talk to whoever the team lead is on the unit. And then they'll go up from there. The charge nurse will be able to see that and kind of facilitate patients moving in and out of there. There'll be 2 nurses up there, 1 tech that will be coming from our emergency department staff until we are staffed up there with hired nurses, particularly for that unit. I think it's going to roll well. Of course, there's going to be kinks and issues along the way. So your input would be greatly appreciated, anything that we can do better. But we're looking forward to opening this unit and just want to give everybody kind of a heads up. And since it being Monday, this was the easiest way to do it. So have any questions or concerns, please let any of us know so we can address those. All right, guys. Thank y'all for everything that you do.